Most people who wake up at 3 in the morning blame the same things. Too much coffee, stress from work, getting older. Maybe they need to use the bathroom. They lie there in the dark, wait for sleep to return, and by morning they've forgotten it happened. I've heard this story hundreds of times, and every time I ask the same question that nobody else has asked them. How long has this been going on? Because here is what I've learned after years of reviewing the histories of cardiac patients. People who came to me after a serious event, a heart attack, a dangerous arrhythmia, a stroke that happened in the early hours of the morning. Almost all of them had been waking up at night for months, sometimes years, and almost all of them had been told, or had told themselves, that it was nothing. It wasn't nothing. My name is Dr. Emmanuel Osei. I'm a cardiovascular surgeon with over 2 decades in the operating room, and today I'm going to show you 5 specific reasons why people over 60 wake up in the middle of the night. Reasons that have nothing to do with stress or aging, and exactly what to do about each one. Stay with me. By the end of this video, you'll never look at a 3 a.m. wake up the same way again. Before we get to the 5 causes, I need you to understand something about what your cardiovascular system is actually doing while you sleep. In a healthy body, nighttime is a restoration period. Your blood pressure naturally drops by 10 to 20%. Your heart rate slows. Your arteries relax. It's a biological reset your body has been running every night of your life. But after 60, that system becomes unreliable. Your blood vessels stiffen. The pressure regulation becomes less precise. Hormonal signals that used to protect the heart at night start to weaken, and certain conditions that were manageable during the day. When your cardiovascular system has backup mechanisms, when it can compensate and adapt, become genuinely dangerous in the hours when the body is running on a skeleton crew. Here's the number that stops people when I tell them. The hours between midnight and 6 in the morning carry the highest risk of heart attack and stroke for people over 60. Not the afternoon, not the morning rush, the quiet hours. And the most important thing you did to determine what happens in those hours? You did it before you went to bed. That's what we're going to talk about, starting right now. Most people check their blood pressure in the morning. Some check it in the evening. Almost nobody checks it at 3 in the morning. And that's exactly the problem. There is a condition called nocturnal hypertension. It means your blood pressure doesn't drop the way it should during the night. Or worse, it actually surges during the early morning hours while you're asleep. You have no idea it's happening. There's no pain, no obvious symptom. You might just find yourself lying awake for no clear reason, slightly restless, unable to get back to sleep. Here's why that matters. When you're awake and upright, your arterial walls are, in a sense, braced. The pressure is expected. The system is active. While you sleep, those walls are not braced for impact. A pressure surge at 3 in the morning hits arterial walls very differently than one at 3 in the afternoon. It is more likely to rupture a vulnerable plaque inside a coronary artery, more likely to trigger clot formation. Research has consistently linked nocturnal hypertension to a significantly higher risk of stroke and heart attack, independent of daytime blood pressure readings. You can have perfectly acceptable morning numbers and still have a serious problem happening every single night. The cruel part? Your regular checkups won't catch it. Your doctor sees your daytime number. The nighttime surge is invisible. If you are over 60 and you take blood pressure medication, have a specific conversation with your doctor about the timing of that medication. Ask directly, should I be taking this at night rather than in the morning? There is strong published evidence that evening dosing of blood pressure medication significantly reduces cardiovascular risk during sleep. Most patients have never had this conversation. It takes 2 minutes, and it could be one of the most important medical discussions you have this year. I want you to think about someone in your life who snores. A spouse, a parent, a sibling. That sound, loud, irregular, sometimes followed by a sudden silence and then a gasp. Most people treat it as an inconvenience, something to elbow your partner over. I treat it as a cardiac warning sign until proven otherwise. Sleep apnea is one of the most underdiagnosed conditions in people over 60. Estimates suggest that over 30% of older adults have some form of it. The vast majority have never been diagnosed or treated. Here is what actually happens during an apnea episode. You stop breathing. For 10 seconds, 30 seconds, sometimes longer. Your oxygen level drops sharply. Your brain registers a crisis and fires off a stress response. Adrenaline, cortisol, a sudden spike in heart rate and blood pressure. Your heart jolts awake while the rest of you is still asleep. Now imagine that happening 30, 40, 50 times in a single night. Night after night, year after year. The data on what this does to the cardiovascular system is not subtle. Sleep apnea is directly associated with a significantly elevated risk of heart attack. It is strongly linked to atrial fibrillation, an irregular heart rhythm that itself dramatically raises stroke risk. It accelerates the stiffening of arterial walls, and the person experiencing it often has no idea. They just know they wake up at 3 a.m. They just know they feel exhausted every morning, even after 8 hours. They just know their partner says they stopped breathing in their sleep. Warning signs beyond snoring. Waking up with a headache. Feeling exhausted despite a full night of sleep. Waking up with a dry mouth or a feeling of choking. Needing to urinate frequently during the night. This one surprises people, but the pressure changes during apnea episodes directly stimulate the bladder. If 2 or more of those signs are familiar, talk to your doctor about a sleep study. This is not optional at 60+. It is part of taking your heart seriously. The treatment, most commonly a CPAP device, is not glamorous. I know that. But patients who use it show measurable reductions in blood pressure, lower rates of atrial fibrillation, and significantly reduced cardiac risk. One device, one habit, enormous protection. This one surprises almost everyone I mention it to, because it has nothing to do with what people typically think of as a heart problem. Your heart is a muscle, and like every muscle in your body, it runs on electrical signals. Those signals are regulated by minerals, specifically magnesium and potassium. After 60, several things happen simultaneously that make deficiency extremely common. Your kidneys become less efficient at retaining magnesium. Your dietary absorption of both minerals decreases. And here is the one that most people never hear. Certain medications that millions of older adults take every day actively deplete these minerals. Diuretics, water pills, commonly prescribed for blood pressure and heart failure, cause significant potassium and magnesium loss with every dose. Proton pump inhibitors, used for acid reflux, directly deplete magnesium in ways that took medicine an embarrassingly long time to recognize. What does magnesium deficiency feel like at 3 in the morning? A muscle cramp that wakes you from deep sleep. A racing or irregular heartbeat that settles after a few minutes. Restlessness you can't explain. Difficulty returning to sleep even when you're exhausted. Low potassium produces similar patterns, and in severe cases, both deficiencies are directly linked to dangerous cardiac arrhythmias. Here's what makes this so frustrating. Standard blood tests measure serum magnesium, the amount circulating in your blood. But only about 1% of your body's magnesium is in your blood. The rest is inside your cells. You can have critically low cellular magnesium with a serum level that looks completely normal on a lab report. Your doctor sees a normal number and moves on. Your heart is running on empty. If you take a diuretic or a PPI long-term, ask your doctor to check both your magnesium and potassium levels, and ask specifically whether a supplement is appropriate. For magnesium, the form matters enormously. Magnesium oxide, found in most cheap drugstore supplements, is poorly absorbed. Magnesium glycinate or magnesium malate absorbs significantly better. 300 to 400 milligrams daily is a typical target, but discuss this with your doctor before starting. For potassium, dietary sources first: leafy greens, avocado, sweet potato, banana. Supplementation requires more caution because too much potassium carries its own cardiac risk. This is a conversation to have, not something to self-prescribe. Here is something most people over 60 don't know about their body between midnight and 4 in the morning. If you ate a significant amount of carbohydrates in the evening, pasta, bread, rice, something sweet, your blood sugar went up after dinner. Your body released insulin to bring it down. And in some people, particularly those with any degree of insulin resistance, that insulin response overshoots. Blood sugar drops below normal in the early morning hours. This is called reactive hypoglycemia. And the body's response to low blood sugar in the middle of the night is not subtle. Adrenaline is released. Cortisol surges. Heart rate increases. Blood pressure rises. You wake up abruptly, sometimes with your heart pounding, sometimes with sweating, sometimes with a feeling of anxiety that you can't explain. This process is stressful for the cardiovascular system under any circumstances. In someone over 60 with existing arterial stiffness, elevated blood pressure, or a history of cardiac issues, that 3 a.m. adrenaline surge is not trivial. There's another layer. For people who have been diagnosed with diabetes or prediabetes and are taking certain older diabetes medications, sulfonylureas, drugs like glipizide or glyburide, Nighttime hypoglycemia is a well-documented risk. These medications force insulin production regardless of blood sugar level. And in older adults, the classic warning signs of low blood sugar, shakiness, sweating, confusion, are often blunted by age. The body is in danger, and the alarm system isn't working properly. If you regularly wake up in the early morning hours with a pounding heart, sweating, or a feeling of anxiety, consider what you ate the evening before. A small protein-based snack before bed, a handful of nuts, a small amount of cheese, a boiled egg, can stabilize blood sugar through the night far more effectively than avoiding food entirely. If you take diabetes medication, ask your doctor specifically about the risk of nocturnal hypoglycemia and whether your current medication has a safer profile for overnight blood sugar management. Newer classes of diabetes medications carry significantly lower hypoglycemia risk. You deserve to know your options. This last one is the one I need you to take most seriously, and I want to be direct about it. Atrial fibrillation, an irregular, often rapid heartbeat, frequently begins as brief, self-terminating episodes that happen at night. The heart goes out of rhythm for 30 seconds, a minute, 5 minutes. Then it returns to normal on its own. The person wakes up with a strange fluttering sensation in the chest, or a pounding, or simply an odd awareness of their heartbeat. They lie still. It passes. By morning, it's gone. This is called paroxysmal atrial fibrillation, and it is one of the most significant and underdiagnosed cardiac risks in people over 60. Here is why it matters so much. During an episode of atrial fibrillation, the upper chambers of the heart quiver instead of contracting properly. Blood pools in a small area called the left atrial appendage, and pooled blood forms clots. When the rhythm returns to normal, that clot can be ejected from the heart and travel directly to the brain. That is a stroke. Studies estimate that atrial fibrillation is responsible for roughly 1 in 5 strokes, and a significant proportion of people who have their first atrial fibrillation-related stroke had no prior diagnosis because their episodes were brief, nocturnal, and self-terminating. They never mentioned it to a doctor, or they mentioned a vague feeling of palpitations and were told it was probably nothing. There are other symptoms worth knowing. Waking up with unexplained fatigue the morning after an episode, mild shortness of breath that wasn't there before, a vague feeling of unease in the chest that's hard to describe precisely. If you have ever felt your heart flutter, race, or feel irregular in the middle of the night, even briefly, even if it resolved, tell your doctor. Ask specifically for a Holter monitor or an extended cardiac monitor. A standard ECG taken during a routine appointment almost never captures a paroxysmal episode. Monitoring over 24 to 48 hours, or even longer, is what reveals the pattern. There is also now a generation of consumer devices, certain smartwatches, that can detect atrial fibrillation with reasonable accuracy. These are not a substitute for formal diagnosis, but if you experience nighttime symptoms and your doctor has dismissed them, a wearable that logs irregular rhythm episodes gives you documented evidence to bring to your next appointment. If atrial fibrillation is confirmed, it is treatable. Anticoagulant therapy dramatically reduces stroke risk. Rhythm management options exist. The worst outcome is the one where nobody looked because nobody asked. I want to tell you about a man I'll call Raymond, 68 years old, retired architect, the kind of person who is meticulous about everything: his diet, his weight, his annual checkups. He had been waking up at 3 a.m. for about 8 months when he came to see a colleague of mine. His explanation was always the same: stress. He'd recently sold his business. There was a lot on his mind. His doctor had told him it was anxiety and suggested he consider a sleep aid. He didn't take the sleep aid. Something didn't feel right to him about that answer. When he described his symptoms in more detail, the brief pounding sensation, the way his heart felt like it was skipping, the way it would settle after 5 or 10 minutes, my colleague ordered an extended cardiac monitor. 14 episodes of atrial fibrillation captured over 3 nights. The longest lasted 11 minutes. All of them between 1 and 4 in the morning. All of them self-terminating. All of them happening while Raymond was lying in bed in the dark, wondering if he was just anxious. He wasn't anxious. He was in atrial fibrillation. He was started on anticoagulation therapy. His sleep was evaluated, and mild sleep apnea was found and treated. His magnesium was low, corrected with supplementation. 6 months later, Raymond told my colleague something that has stayed with me. He said, "I almost took that sleeping pill. I almost decided to just live with it." He didn't. And the decision to push for a real answer instead of an easy one may have been the most important health decision of his life. I want to say something directly before we close. Waking up at 3 in the morning is not just a nuisance. It is your body sending you a signal. And that signal deserves a real answer, not reassurance, not a sleep aid, not you're just getting older. You are not a passive recipient of whatever explanation is easiest. You are someone who watches a video like this one at the end of the day because you take your health seriously. That matters. That is the difference between the people who catch things early and the people who don't. The 5 causes we discussed today are all real, all common, all underdiagnosed, and all of them have something in common. They are manageable when you know what you're looking for and you ask the right questions. Your doctor is your partner in this, but you have to bring the information to the table. Nobody is going to ask you at a standard checkup whether your 3 a.m. wake-ups might be nocturnal hypertension or early atrial fibrillation. You have to be the one who raises it. 5 reasons why people over 60 wake up at 3 a.m. and what to do about each one. 1. Nocturnal hypertension. Your blood pressure surges while you sleep. Ask your doctor about evening dosing of your blood pressure medication. 2. Undiagnosed sleep apnea. Your airway collapses repeatedly through the night. Get evaluated if you snore heavily, wake up exhausted, or have ever been told you stop breathing in your sleep. 3. Electrolyte deficiency, specifically magnesium and potassium. Ask your doctor to check your levels, especially if you take a diuretic or a proton pump inhibitor. 4. Blood sugar instability. A late carbohydrate-heavy meal drives an overnight adrenaline surge. A small protein snack before bed, and a conversation about your diabetes medication if relevant. 5. Atrial fibrillation. Brief, self-terminating episodes at night are the most commonly missed cardiac diagnosis in older adults. If you've ever felt your heart flutter or race in the middle of the night, even once, tell your doctor and ask for extended cardiac monitoring. I want to hear from you. Have you been waking up in the middle of the night and dismissing it as stress or age? Has a doctor ever told you it was nothing to worry about? Tell me in the comments. I read every single one, and your experience might be exactly what someone else watching this needs to hear to finally take their own symptoms seriously. If this video gave you something useful, please share it. Not for me, for someone in your life who has been waking up at 3 a.m. for months and has never once connected it to their heart. That person exists. You probably know who they are. Send this to them. It costs you nothing. It might change everything. Everything I've shared today is based on current cardiovascular research and my clinical experience as a cardiovascular surgeon. This is general information, not personal medical advice. Always consult your own doctor before making any decisions about your health. Take care of your heart. It has been working for you every single minute of your life without ever asking for anything in return.